At the same time, our colleagues at the University of San Diego and Indiana University's Lilly School of Philanthropy were also in the process of issuing their own survey to nonprofit networks. So after reviewing all of this existing evidence, this led us to pursue 5 major research objectives. The first was to understand the major challenges, just catalog what nonprofits are going through at this moment. What are the financial challenges? What are the strategic and operational challenges? We also wanted to know what nonprofits are doing, what strategies they're taking to mitigate the negative effects of the crisis. We wanted to know the extent to which nonprofits have experienced changes in funder support, so how governments, how foundations, how corporations are changing their relationships with nonprofits. We wanted to know whether and how nonprofits have been able to access CARES Act aid. And finally, we wanted to know what types of assistance nonprofits considered most necessary at this time. So we know from conversations with nonprofit stakeholders that there really is a dearth of research that's truly representative of the geographic diversity of organizations in Washington state, as well as the unique concerns of relatively smaller nonprofits compared to large nonprofits. So we sought to make this research as representative of the wide variety of organizational experiences across Washington state as humanly possible. For this reason, we elected to pull what's called a stratified random sample of nonprofit organizations. All this means is that we divided our universe of Washington nonprofits up into buckets based on geography and organizational size. We then drew random samples from each of those buckets proportional to the number of nonprofits it contained. We used the IRS Business Master File as our sort of sampling universe and divided up the state into 3 sort of geographic buckets: Puget Sound region, Southwestern Washington, and Eastern Washington. And we use an indicator of organizational size, which is whether a nonprofit fills out a traditional Form 990, the long form, or fills out the short form, which tends to be relegated to smaller nonprofits. We ended up with an effective sample size of, even though we stratified the random sample with 701 organizations, we end up with an effective sample size of 600 organizations. We oversampled health and human service organizations, as you'll see going forward in this presentation, because these organizations are delivering essential services like medical care, emergency financial assistance, housing, food, things that were rendered in sharp need relative to the start of the crisis. So these are the types of services, and these are the types of organizations that we expected to see a unique experience relative to non-health and human service nonprofits. So as we go forward, you'll see all of our analysis broken up into those 2 spheres. We distributed our online survey between mid-June of 2020, and we closed it out in late July. We were targeting executive directors and high-level staff to complete the survey under the assumption that those folks would have a sort of better operational understanding of what's going on at a high level, which is kind of where our questions are situated. Of our 600 effective organizations in the sample, we were able to secure 209 responses. So 209 nonprofits took the time to answer this survey, and giving us a response rate of 34.8%. And overall, as you'll see in the subsequent slides here, we'll find that our sample is representative across the 3 major geographic areas of Washington, as well as in other dimensions that we'll talk about. So as you can see, even though we break up the state into 3 major geographic regions, this choropleth gives you an idea of our response rates by county. So our darker shades of purple are going to indicate response rates closer to 100% by those counties. And we see that we have fairly uniform coverage across most counties. We have a couple in which we had unusually high response rates. Note that for the counties in white, well, we didn't randomly draw any organizations from those counties. Our sample is also fairly representative of the service sector breakdown in Washington state that we see in the wider sampling universe. The major components of our responses are working in human services, education, and health. And this is particularly important, as I said before, because many of these fields were those that were sort of deemed essential in light of the crisis. Geographically, we find that 3/4 of our residents work at the local level. By that we mean community, municipality, or county level. About 15% are working at the state level, and only a handful consider their service area sort of national or global. A lot of nonprofits, in terms of who they serve, a lot of nonprofits indicated that they serve children as their sort of primary beneficiaries. The majority of our respondents, we learned, worked with what we term vulnerable or marginalized populations, including Black and African American communities, Latinx communities. We also see the lion's share of our organization sort of working with people experiencing homelessness and people with low incomes. These are the communities that were identified by the Centers for Disease Control and Prevention as being at higher risk of not only coronavirus infection, but also the severe economic downstream consequences. So we're going to dive into our findings here, what the survey actually shows as far as our research objectives. Going back to our first objective, just to better understand these challenges, we asked nonprofits to estimate the percent change that they have experienced in these following domains: so demand for services, number of individuals volunteering, etc. So this red line right in the center here indicates 0% mean change, meaning no movement in that area. Dots to the left of that line indicate mean decreases. So the farther they are away from zero, the more profound the change. Dots to the right are going to indicate mean increases. And so you'll see a couple of these as we go forward. Our responses indicate two major trends. The first is that demand for services has increased, due both to the physical and financial constraints facing individuals in light of the pandemic. And as we can see in the figure, this is being driven by health and human service nonprofits. We had a lot of qualitative responses that detailed the nature of the demand increase. One human service organization indicated that they went from providing 25,000 individuals with care to over 800,000 people with care and food in the first few months of the crisis alone. It bears mentioning that not only is demand increasing, but as we'll see in subsequent slides, the pandemic has necessitated new service delivery models to which many nonprofits have had to adapt rapidly in order to be able to safely and effectively serve their communities. Some of our qualitative responses have highlighted the immense psychological and emotional stress facing staff members right now as a result of those more expansive workloads. Many nonprofits told us that they're working to find new ways to support their staff's mental health and maintain a sense of community during this time. The second trend is that the resources that organizations could use to mitigate the increased demand, like volunteer capacity and various revenue sources, are actually decreasing. So program service revenue in particular has decreased among all nonprofits. For our non-health and human service nonprofits, it's because consumers are simply not attending events or requiring non-essential services. Whereas health and human service nonprofits, this indicates a reduction in fees for service. Overall, we see total revenue projected to have decreased for the past 3 months. We asked nonprofits also to tell us a bit more about the specific challenges facing their organization. One human service organization tells us, we had a severe workforce shortage prior to COVID-19, and subsequently it's gotten worse as many staff are burning out from the extensive workload coupled with the economic crisis, racial unrest, and the pandemic. So this theme popped up in a few responses, the idea that learning how to operate in a completely new service modality while also dealing with the deleterious effects of prolonged social isolation is having a really profound effect on staff. The outlook for the next 12 months is also quite bleak for non-health and human services nonprofits especially. Most sources of revenue are expected to decrease, including contributions from individual donors and program revenue. And while health and human service organizations don't project concomitant decreases in funding sources as their non-health and human service counterparts. The effects in terms of program service revenue and total revenue are in that same direction, so projected decreases. There are some hopeful spots emerging, however. So very recent reports within the last week or two from the Center for Effective Philanthropy and the Council on Nonprofits have actually projected that foundation giving, for instance, will increase in the next 12 months. So we are seeing silver linings pop up. So just to summarize here, major challenges facing nonprofits. Demand for service is increasing as a result of the physical and financial effects of this. Revenues have and are expected to continue to decline in the upcoming year. And then, importantly, volunteering, which is a mechanism by which a great deal of nonprofit work gets done, has decreased, putting additional strain on nonprofit staff. Related to the increase in service demand, some nonprofits have actually fundamentally changed the way that services are provided. Many have moved entirely to virtual platforms, which, as we'll see, is difficult in terms of equitably serving different communities. Other nonprofits have had to change the venues in which they provide physical services to accommodate social distancing requirements. Most nonprofits, especially those that are not in the health and human service field, have actually paused one or more of their programs, non-essential programs. And some nonprofits have had to quickly add new programs to address emergent concerns as a result of the crisis. Relatively few organizations, though, report changing their long-term organizational goals. When asked about the changes that nonprofits are making in terms of organizational capacity, most respondents of any stripe have reported decreasing staff and volunteer capacity. Here we're looking really at the extent to which the organization is saying that they have elected to or chosen to decrease staffing and volunteers as a result of pressures, financial pressures and operational pressures. Volunteers have been more difficult to equip in terms of personal protective equipment. In fact, we had several qualitative responses that highlighted the unexpected added expense of providing PPE to volunteers and staff alike. Consistent with many reports that came out between April and June in 2020, many nonprofits also reported that they furloughed employees. We found also that nonprofits overall are really increasing their advocacy efforts with respect to COVID-19. And we hope to discuss this more with Laura later on in the session. So imagining not only having to fundamentally reimagine the way that existing programs are provided, but also stepping up to advocate on behalf of their communities relative to COVID-19 is something that was a surprising finding for us. In terms of the financial strategies that nonprofits have adopted, we see that many organizations have applied for CARES Act assistance. When we sent out the survey, it was right after nonprofits had received their first round of CARES Act aid, and we're sort of having that trickle in. And it was right before the second round got announced. So we were particularly interested in the dynamics of that. And we found that, as you can see, a lot of organizations took advantage of that. We'll explore this more in the next couple of slides. Health and human service nonprofits, especially here, took advantage of other state and local forms of assistance. Many, as we've found, have actually spent down cash reserves to weather the more immediate effects of COVID. This is particularly worrisome when coupled with lower expected individual contributions in the upcoming year. Cash reserves are generally difficult to repopulate in times of low profitability, so this puts some nonprofits in precarious positions down the road. So overall, we find in terms of our strategic changes here, operational and financial changes, that the strategies may have some consequences for long-term solvency. And we also see, as we've seen in the previous slides, that choosing to lower staff counts is a primary strategy that nonprofits have adopted. So somewhat contrary to our prior expectations, we found that the uptake of CARES Act was relatively high. As you know, the primary CARES Act lever, the Paycheck Protection Program loan, was delivered in a decentralized way through private financial institutions, which we sort of loosely hypothesize contributed to the relative accessibility of the program. So we found that 60% of our respondents applied for one or more forms of CARES Act assistance. And very surprisingly, for those that did not apply, we asked them if they were interested in doing so. 89% of those organizations indicated that they were not interested in applying. We found that 95% of respondents were actually approved for Paycheck Protection Program aid by the time they received the survey, and 89% of those organizations had actually received the money in hand by the time they received the survey. We also asked about any difficulties that nonprofits encountered in the process. So early on in the crisis, there were many reports about how difficult the CARES Act was to navigate in terms of its applications. And asking our respondents, we find that 61.3% of respondents had no difficulties, reported no difficulties in the CARES Act process. The most commonly reported difficulty associated with CARES Act receipt, however, was in the application process rather than the actual disbursement of funds. So one of the things that we noticed in our qualitative evidence, however, indicated that there may be some confusion, particularly among smaller nonprofits, about the criteria for loan forgiveness, including what types of expenses the loan money can be used for and the spend down dates. One respondent in particular noted that the loan forgiveness criteria were complicated and that some nonprofits may have been using that money early on for items that were not included in the forgiveness criteria, which raises short-term concerns about continued financial volatility coupled with a loan they may need to repay. This concern was actually also consistent with some of the reports that came on National Public Radio back in May regarding the uptake of PPP loans among small businesses. One of the strategies that has become really apparent over the course of the pandemic is that nonprofits have been working together to make the most of limited resources, to mitigate fragmented governmental responses, and to really maximize their impact in their communities. We find that most nonprofits are partnering with other nonprofits. Whether that means sharing space, advocating together, pooling resources. Nonprofits are also working with governments to increase testing capacity in communities that did not previously have access to those services. One of the things that has become very clear to us is that nonprofits, despite the very real resource and demand issues that they're currently facing, are developing flexible and clever ways of mitigating the uncertainty and resource deficits. And so this is an important strategic response that has become apparent in light of the pandemic. We don't see partnerships forming to the same extent in non-health and human service organizations. I think that perhaps this might point to a potential actionable step for nonprofits that are not in the health and human service fields that are currently facing strong financial and operational issues. One of our respondents highlighted how the confluence of the pandemic and the protests against police brutality have led to important partnerships and movement building among organizations. Our respondent tells us connections and partnerships are developing with other Black nonprofit leaders and Black-focused organizations. The disparities for Black people exposed by the pandemic has increased awareness and prompted urgent response on these economic, health, and education-related issues. These new collaborations must also be attributed to the George Floyd murder and the widespread protest to police violence against Black people. White-led education advocacy organizations with more robust staffing and resources are looking to organizations of color to set agendas and priorities in our combined work. This is a new level of leadership opportunity for many small community-based organizations of color. Given the disproportionate effect of COVID-19 on certain communities, including the elderly, on Black, Indigenous, and people of color, people with low incomes, people experiencing job or housing insecurity. We wanted to know whether and how nonprofits were explicitly prioritizing these communities, among others, in their COVID-19 response. Our results suggest that while some nonprofits are prioritizing the hardest hit communities, we still see only about 25% of the nonprofits reportedly prioritizing Black, Indigenous, and people of color. We see that many nonprofits report that they are actively prioritizing children. And overall, we find that less than 20% of nonprofits have prioritized older adults who we know are the most strongly affected by the virus itself. The other piece that emerged in this study was the importance of the overlapping effects of the virus and the necessary distancing responses on nonprofit work. So our respondents note some barriers that they face when prioritizing communities with the greatest need. One respondent tells us communication with Native communities is significantly more difficult due to limited access to technology. These are issues affecting all communities of generational poverty. Here we see an example of how the intergenerational effects of poverty and resource asymmetry contribute to further disproportionality in the effects of the crisis. On the other side of the discussion of what nonprofits are doing is the question of what funders are doing to help grantees navigate the current conditions. Importantly, in this question in our survey, funders is a generic term that we use to reflect governments at all levels, institutional philanthropists, corporations, etc. So as you can see in the yellow and goldenrod bars here, we do see some areas in which many funders are making changes, specifically increasing the amount of funding that they're providing and opening lines of communication with grantees. We also see a fair amount of loosening or eliminating restrictions on grant funding at this time. Interestingly, we don't see many of the funders supporting this COVID-19 related advocacy work. So these results, previously presented results, paint a little bit of a different picture than some of the research that's come out regarding funders' self-reported measures in response to COVID-19. So Kelly and I just had a recent article come out in Nonprofit and Voluntary Sector Quarterly that characterizes the COVID-19 responses of 138 of the 500 largest philanthropic foundations by assets in the United States. We're just going to take a moment to explore how these results of our nonprofit survey speak to the results of our other work. We find that 65.9% of foundations, private and community foundations, reported providing more funding to their grantees. Although something kind of interesting about this, if you look at the distribution of that response, about 67% of respondents who reported providing additional funding to their grantees did not report increasing their overall payout percentage. So just suggesting that that money was reallocated rather than additional resources being dispersed. Most foundations have reported loosening or eliminating restrictions and decreasing reporting requirements. Again, most have reported increasing communication, so we see a lot of overlap between our findings from the nonprofit side and our findings from the foundation side. But as our foundation self-report, only about 7.2% of these large philanthropic foundations indicated that they've supported the COVID-19 related advocacy effort of their grantees. So for more information on this paper, we've included a link to it here, and we'll make that available to anybody who's interested. So finally, we asked nonprofits what type of assistance would be most useful to them as they continue to serve their communities. And overwhelmingly, two key needs emerged. As nonprofits are expected to do more and more with less and less, continued funding is going to be imperative to help nonprofits navigate both short and long-term solvency issues. But also for new and existing funding, fewer restrictions in terms of how the money can be spent and the reporting and evaluation requirements will allow nonprofits to conserve on the capacity that they must dedicate to adhering to those funding restrictions. Shifting funding towards general operating support, for instance, would allow nonprofits to cover unexpected expenses incurred as a function of the crisis, and perhaps avoid taking more financial measures that would put them in more precarious solvency positions. To recap, based on our findings, we recommend that policymakers and institutional funders alike take the following steps to reduce the strain on Washington's nonprofit community: alleviating financial volatility by providing more funding, increasing flexibility of that funding, and prioritizing communities with the greatest need by targeting funding towards BIPOC-led and serving organizations, and developing more intentional partnerships with BIPOC-led organizations to more effectively center the needs of these communities. Our next big step in this work is to continue this analysis. We have a lot of rich data that we're looking to explore. We want to subdivide our analysis next by the communities served, as well as by the geographic location of our respondents. We also want to know from your perspectives as practitioners, what would be most helpful for you to know. So obviously feel free to throw any of those ideas in the comments. We're happy to look into those things and provide the types of analysis that are most necessary to support your work. We also plan to conduct qualitative interviews to characterize really the unique challenges that are faced by different types of nonprofits throughout the state. So thank you so much for hearing our work here. And at this point, I'd like to pass the mic to Laura Pierce to give us a sense of what these results in COVID-19 more broadly mean for nonprofit advocacy.
Thank you so much, Emily. It's great. Such a clear presentation. Really appreciate that. So we feel like this is going to help us a great deal in communicating with policymakers and with funders. We really get asked to advocate with both through this process. So, policymakers respond really well to having data, not just anecdotes. We also want to complement that with stories. So we are always reaching out to our members and all of you on the call today. If you have good illustrative stories that help drive home some of these points, we would really love to hear from you too, and make sure that we can communicate just how much nonprofits have stepped up. It kind of feels like nonprofits are both very vulnerable during this time and also incredibly resilient. And I just try to hold both those things at the same time. We just want to make sure that we are partnering well with government and we're helping government really understand all the work nonprofits are doing, not take it for granted. And a lot of legislators that I talk to don't really understand the extent of the nonprofit sector. I appreciate what you covered at the beginning about how many nonprofits there are in the state, what a large employer we are, and therefore what a large driver of the economic recovery we really are. And I feel like nonprofits are going to have a very outsized impact on economic recovery in our state. You really can't have economic recovery without childcare. You really can't have economic recovery without food security and their job training and so many of the services nonprofits provide. Not to mention mental health support, which we are all in need of to varying degrees, I think, given how stressful this pandemic has been. So we are really excited to continue our advocacy, and we want to invite everyone on the call today to consider joining us if you're not already involved. You can sign up with Washington Nonprofits. I'll put a link in the chat right now. And if we are a membership organization, we encourage you to join, but you can also, start by just joining our mailing list if you want to receive action alerts and receive regular updates about what we're doing. We really encourage you to stay in touch with us and become a part of our network. I know some of you are involved in other advocacy coalitions, and we really support that also. And there's so many great groups doing good work. the pandemic has been a time where we have really been able to establish new partnerships, work directly with arts and cultural advocacy coalitions, housing and human services, food security, all the different ways that nonprofits make a difference in our communities. I also want to let you know that during the legislative session, we will be meeting regularly with legislators, and we want to invite nonprofits to join us. And we want to encourage you to go out and actually speak directly to your elected officials. And we have all kinds of supports in place to help make that an easy thing. I know, unfortunately, at times people can feel intimidated to maybe call up their state senator or their congressional representative, but we want to make that easy for you. And if you think about it, nonprofits have so much knowledge about what's going on in our communities. It's really a problem if we don't speak up and provide that information to elected officials to inform their policy decisions. So we have a lot of support for that. We'll be running a campaign in February, getting as many nonprofits meeting with as many of their state legislators as we can during the session. And we would love for all of you to participate in that. And there's no prior experience required. So Daniel and I would absolutely love to hear from you. We'll also provide you with whatever materials you may need to make your case. I think some of these statistics are very powerful, and we're all the time trying to put together useful materials to support that. Of course, the biggest focus is just generally on COVID relief for nonprofits. You saw the financial straits that nonprofits are in for a number of reasons, and we feel like all of these things are essential to our communities. We don't want to lose some of these organizations that have been built up and are part of our kind of community infrastructure. So we're making sure that the federal government knows for the next stimulus package how important it will be to fund relief, preferably in the form of grants to nonprofits. There may be another round of PPP loans in the offing and other kinds of supports that nonprofits need to be able to continue the work. So that's just a broad invitation to be a part of that conversation, to be a part of that statistic that Emily showed you, where a lot of difficult things are happening, but nonprofits are finding their voice and getting more involved in advocacy. We definitely want to support you to do that. So with that, I think we could open it up to whatever questions you all may have. I have a feeling there probably have been quite a few that have come through in the chat. So we're going to kind of manage this, I think, as a community. I guess I'll just open it up and ask if any of the research team is seeing some questions that you can answer for us right now and get us started.
So I'm just looking at the most recent ones that came up, and just a couple of quick points. We got a question from Amber Knox at Teton Arts and Humanities. Did you define CARES Act funding only as loans? Great question. No, we actually looked at the Paycheck Protection Program, the economic injury and disaster loans, the forgetting what the acronym is, the employee retention tax credit, and then we had a generic other category as well. So we break down all of our CARES Act responses by each of those programs. The results that we present in the actual presentation are mostly geared towards PPP, because we found that to be overwhelmingly the most common source of assistance that folks sought under the CARES Act. So I hope that answers your question.
I wanted to respond real quick to Erica's question about us asking similar questions as Blue Mountain Community Foundation and Sherwood Trust Impact Report. I think for a lot of these reports, the questionnaires were circulating among the different researchers so that we could be asking similar questions and ultimately try to do some comparative work. So while we haven't done that yet, we'd like to look both with how does this compare with other states as well as funders and sort of try to get a balanced picture of it that way. So thanks for that question, and look for hopefully more analysis coming up. Oh, and Kelly's got that in the chat too. Thanks, Kelly.
See someone asking if regional information might be available or whether they could request data pulls for their geographical area.
Yeah, so we can, I want to be a little bit careful about how granular we can go with any of those findings because King County is one thing because we do have a substantial amount of response just based on the density of the nonprofits in this county. As we start extrapolating that out, as the buckets get smaller and smaller, there's a lot more variability in those samples. So I'd be hesitant to try and infer anything from those littler samples to the larger ones. So the short answer is yes, but the long answer is be careful. Be careful about that.
I see Liz Mills was asking for a little more clarification about the foundation statistic. The 65.9% of Washington foundations provided more funding. Can you clarify what the universe was that you got that statistic from?
Yes, sorry, I was unclear there. So those foundations are not just in Washington, those are foundations around the US. So that is essentially our sample is the 489 largest philanthropic private and community foundations in the United States based on total assets. So we're looking really at the whole country in terms of those results in that paper.
Could you talk a little bit about different size nonprofits and any insights you might have there or future work you're doing to try to tease out how the effects may be different?
Yeah, that's a great question. That is definitely a next step in the analysis. We've done some brief kind of sensitivity checks on the results that we're seeing. And kind of understandably, we find that a lot of the demand effects that we saw, the average demand increases are really driven a lot by our big health and human service nonprofits. More work remains to be done as to disaggregate other really important challenges. So yeah, that's next on the agenda.
I noticed someone was commenting that they thought medium-sized nonprofits might be harder hit. And I think that comports with my understanding in general because the larger ones just have a little more resources and are more likely to have reserves and assets that can help carry them through, a little more political clout also. The really small nonprofits, and in Washington State, the vast majority of nonprofits have no staff at all. Those groups in some ways are inherently more sustainable because if you don't have staff, you don't have as big of a budget. And there's still a lot of concerns there. And I know a lot of volunteer-based nonprofits have had to essentially mothball their operations for a while. But in some ways, it may be easier for them to bounce back. Whereas I've heard from a lot of medium-sized organizations that they're losing trained staff, and it won't be that easy to get those folks back and get up and running at the same level that they were. So I just want to, for whoever commented on that it matches my understanding. And there's also been a great amount of research done in arts and cultural realm indicating that the medium-sized organizations are the most vulnerable there as well. I did not catch any more questions, but I'm sure others did. So I'm going to open it up.
One thing that was asked was about the extent to which going forward we'll be looking at individual donations and donors, so that we focused a bit more on institutional donors for the reasons about who our target audience was for this first round of research. And whoever asked that question also acknowledged it can be tougher to get information about individual donors. So we'll have to figure out how to go there. and figure out that, but it's on our radar for sure, since individuals are such an important part of the contributed income to nonprofits. I wanted to acknowledge that question as well, because it might be on other people's minds.
Great. I see there's a question in here from Liz. Are there plans to share this report with state legislators? Yes, in fact, we were just talking before the call on how we could get create a one-pager from this report that would be suitable to share with legislators and digestible that way. I am going to share in the chat a link to some of the materials that we've already put together for talking to legislators, because we do have some good materials already. We will update them, and we will integrate some of this, and also work with the Evans School, because I do think that having something that, has the imprimatur of the university is helpful when we go out and talk to the legislators as well. But I'll share that. And I don't know if you all want to add anything.
I would say that has been on our radar since the very beginning. And as much as we would like to think that folks are going to read the entire report, we're pragmatists too. So that's our next phase. And probably like in one of the very next things we'll be doing is kind of slice and dicing this for different audiences. So also, if any of you have requests about or ideas about ways to slice and dice this that would be in service to you, pop that in the chat as well. Because we're definitely that's next step. Given where we're at in the calendar year, and as that relates to session, we definitely want to have those tools in place as we go into advocacy season. Yeah. So looking at the chat, looks like Kelly's responded to this question. There's a question about whether or not we asked about board composition. We did not this time around, but that's if you're willing to say more, I'd be interested about what's behind that question. Like what draws your attention to the idea of looking at board composition specifically? I have some hypotheses, but I would love to hear from you. Oh, I'm just seeing, Monique, your suggestion about, or your interest in looking at long-term how pandemic affects mission creep and or change of nexus, which, I think sometimes it's a little difficult to distinguish between the two. We started to get at that a little bit, but that idea is really interesting and important. Yeah.
Excellent. Thank you.
Thank you.
I see we have another. Sorry, go ahead.
Oh, I was just going to say we're nearing the end of our hour. Why don't we hear any final comments from the researchers, and then we'll close it out.
I would say that the only sort of final thing I have is we're so grateful for the nonprofits and all the work you do, and taking the time to fill out this survey that was long, we know, but we're dedicated to making this information as actionable as possible. And so this conversation that we're having in the chat is so informative from our perspective, and we'll take that going forward and turn this around into stuff that is useful to the critical work you're doing. So thank you.
Wonderful. Well, we really appreciate you sharing this back. I think that nonprofits often feel that they're surveyed and that then they don't necessarily know what happened to the information. And this is shared back with us in a really useful way. I want to also highlight that Washington Nonprofits is listening and appreciative that you asked what type of assistance nonprofits could use. We're going to be following up on that. And I want to let everyone know, I know that everyone is now trying to figure out how to adjust to the new restrictions that the governor just announced. And we are working hard to get an event scheduled probably for next week. We hope to do it before Thanksgiving, where we would have some folks from the governor's office come in and tell us a little bit more about the restrictions, and then have some time for nonprofits to talk in small groups and really support each other to figure out the way forward. So if you are in a nonprofit where you're trying to figure out if you can keep a program open or not, or how to do it safely, we look forward to supporting you by offering opportunities for you to learn more and work through that. So stay tuned on that. We'll make sure that as we know more, we let everyone in this audience know about it. So thank you all for joining us today. And I hope that everyone will have a fabulous afternoon. Thank you so much, UW team.
Thank you, Washington Nonprofits, for hosting.